afternoon. Thank you for joining us for the City of Toronto COVID-19 media briefing. Up first, we have Mayor John Tory. Go ahead, Mayor.
Well, Ivan, thank you and good afternoon. I'm proud to say that we now have more than 3.9 million vaccine doses administered in our city. We're just very, very close to that 4 million mark. Over 60% of adults, eligible adults in the City of Toronto, fully vaccinated. So thanks to Team Toronto, who've been on the ground every single day working hard to get shots in arms. We're making amazing progress in our efforts to get people vaccinated quickly. We continue to have available appointments at city-run clinics, so if you need to book your first or your second dose, you can do that right away. If you book for later this summer or even into the fall, please consider moving your appointment to an earlier date because it helps you to get the protection faster, but it also helps us to achieve collective protection faster as well. And of course, for those who do not or cannot book an appointment in advance, you can now walk in to the following 4 sites: the Metro Toronto Convention Centre, the Cloverdale Mall, the Toronto Congress Centre, and the Hangar. Each of these places have made appointments available on a walk-in basis so that you can get your vaccine in a relatively short period of time, with these appointments being available between 12 noon and 7 p.m. Encourage those who want to take advantage of these walk-in opportunities to arrive as early as you can. Last week, I announced that our Team Toronto homestretch vaccine push to help increase vaccine uptake in the York, Etobicoke, Rexdale area was going to be getting underway. We targeted 6 priority neighborhoods, including Elms, Old Rexdale, Kingsview Village, the Westway, Mount Dennis, Mount Olive, Silverstone, Jamestown, and Weston, Black Creek, Humber, as well as Englemount, Lawrence. The clinics held so far are in convenient locations in and near buildings where people live and have flexible afternoon and evening hours to take account of frontline workers or those with various differing shifts. Along with Councillor Cressy, I had the opportunity to visit 2 of those many clinics over the course of last weekend, and what we saw was very impressive from every standpoint. The clinics continue to run to this day, but I wanted to provide a brief update because what we've seen is that this targeted approach is working. We've seen that there are barriers that exist, whether it's location or time or access or language, just to name 4. And when you remove those barriers, a lot can be accomplished. In the first 4 days of the homestretch vaccine push, over 4,800 doses were administered at these clinics, with a large majority of them being to people 18 plus. To dive deeper into that, we administered 2,615 doses in the 6 neighborhoods over the July 10th and 11th weekend. That compares to 1,400 doses the weekend before. So that's an increase of 1,215 doses, or an 87% increase weekend over weekend. 16% of the total doses administered in those clinics were first doses, which is significantly higher than the rate of first dose now being experienced in our city-wide clinics. One clinic alone, administered 55% first doses to the people who came to that clinic. As we mentioned, part of this push included other initiatives like phone calls, text messages, and direct outreach, including knocking on doors and going into the lobbies of apartment buildings to get the word out. We've heard some great stories from people on the ground about how they, as ambassadors, are making a difference and how this targeted approach is doing what we set out to do. One of the people the team spoke with was homebound and was so thrilled when there was a knock at his door. And he was booked for his vaccine in August, but because his home care worker happened to answer the door that day, he's now being vaccinated today, a month ahead of when he would have been, along with 2 other identified homebound people in that building. So again, showing the value of person-to-person contact. Another story which demonstrates the importance of community ambassadors being involved in the door knocking came when one of our ambassadors was approached by a resident in a building interested in what we were doing. The woman was herself a PSW, personal support worker, and already had her 2 doses, but had a strong reaction to the vaccine, which concerned her daughter and made her daughter hesitant about getting vaccinated. Her daughter was known to the community ambassador, and as a result of a conversation between the 2 of them and kind of a question and answer period, the daughter was comfortable enough to book her own vaccine appointment. So again, it's person by person, building by building, ambassador to resident, and the system is working. These are the types of connections and conversations our community ambassadors are having every day with residents, and why this targeted push with ambassadors and with a kind of door-to-door approach has been and will continue to be so important. It's having a real impact, and it has opened the door for more discussion around taking a targeted approach in more communities across the city where we see vaccination rates are lower. Some of this, as these stories illustrate, has to do with trust, whether it's a lower level of trust in the system as a whole, whether it's a lower level of trust in the vaccines or other aspects. And these conversations take place with ambassadors who the residents do trust. And that helps us go a long way to getting the vitally important vaccinations agreed to. These conversations are ongoing as we see other areas with low vaccination rates to target. But in the meantime, I want to thank our partners, including city staff, Toronto Public Health, Team Toronto, Michael Garron Hospital, UHN, and numerous community agency partners that represent the true grassroots of the north and the west of the city, and many others who made this possible, together with Humber Hospital and others who've been doing great work in this area for several months now. You'll hear more from Dr. de Villa about the vaccines and the mixing of vaccines and all of those questions that continue to come up. May I just plead with people to pursue getting advice from their family physicians, but also to remember the advice of our very own highly skilled medical experts here in Toronto, in Ontario, and in Canada, who have repeatedly assured us, including our own Dr. de Villa, that vaccines, different vaccines, and combinations of vaccines are safe and effective. Random and sometimes out-of-context communications from international officials are not helpful in our own vaccination efforts, especially when those very same organizations advise people to rely on local expert advice. And the local expert advice has been to make sure that you know that it is safe and effective to have mixes of vaccines, and that all of these vaccines, as they've been saying repeatedly, any vaccine is a good vaccine. Since the province announced that Toronto is entering, along with the rest of the province, step 3 of their reopening plan later this week, city staff have been hard at work getting some city services and amenities back into shape to welcome residents back safely. Pleased to be able to outline today what step 3 means for Toronto and for some of our own services and facilities as we work to reopen additional recreational amenities. On Monday, July 19th, indoor fitness centers, walking tracks, and weight rooms, indoor permits for meetings and events, and indoor public access to community center spaces for heat relief, washroom, and shower access will all reopen. Wednesday, July 21st, indoor lane and leisure swim, as well as indoor drop-in programs for sports and leisure, will reopen. And on Monday, July 26th, enhanced youth spaces, indoor aquafit classes and fitness classes, senior centers, and conservatories will all reopen. I want to reassure people that city staff have worked closely with Toronto Public Health to make sure that these reopenings are implemented safely and with all necessary adjustments to program capacities and program descriptions in order to ensure that these programs and services are being delivered safely. Access to community centers and indoor activities do not require reservations, although reservations will be available for fitness centers, aquafit, group fitness classes, and lane and leisure swim with walk-in spaces set aside. All other activities will be managed on a first-come, first-served basis. While we continue to use our community centers for Camp TO and our COVID-19 response, including vaccine clinics, amenities this year will focus on self-directed activities, fitness classes, and indoor lane and leisure swims. Instructional programming will ramp up through August and into the fall as outdoor services wind down after Labor Day. Additionally, indoor exhibits, including Centennial and Allen Gardens conservatories, are also able to reopen in Step 3. Allen Gardens Conservatory is undergoing capital repairs and will partially open to the public. Outdoor exhibit capacity limits at Riverdale Farm and High Park Zoo expand to 75% when we enter Stage 3. And our outdoor recreational programs like outdoor lane and leisure swim, outdoor fitness classes, Camp TO, Parks Play TO, and Summer in the Six will all continue. And you can find more information about all of this at toronto.ca/exploreenjoy/recreation. As part of Step 3, the Toronto Zoo will be welcoming people indoors with limited capacity starting this Friday. And more details can be found on their website at www.torontozoo.com/welcomeback. All of this represents a very exciting moment for Toronto, but it doesn't take away from the fact we still have to follow the public health guidelines that are still in place, and most important of all, that we continue the push to get ourselves vaccinated and to urge other people around us to get vaccinated. But what is happening with the things that are opening up next week in our parks and recreational facilities and elsewhere is a true sign that normalcy is returning to the City of Toronto. We just want to keep it going in that direction and make sure that no backsliding takes place, especially when you look at some of the numbers that have been recorded in other places. I want to just conclude by thanking our city staff who've worked so hard to get things reopened, but also to make adjustments to programs so that we could reopen them safely and make sure that it could happen as soon as possible, but also as safely as is possible. Now I'd like to ask Dr. de Villa to come and for remarks for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 30 new cases of COVID-19. 65 people are in the hospital and 25 are in ICU. I'm sorry to say that there have been 4 more deaths from COVID-19. For all the good news these days, these deaths are a reminder that while we are moving in the right direction, we have not yet arrived. The first thing I want to address today is the concept of receiving a combination of 2 different vaccines, as many, many people have already done in Toronto. There has been some confusion following comments on Monday by an official of the World Health Organization. She was responding to a question about the need for future booster shots. Since then, her answer is sometimes being repeated as if she was talking about the mixing and matching of first and second doses. She was not. She was describing what would happen if people decided to try to get a booster on their own and did not rely on medical advice. In Ontario, we follow the advice of the National Advisory Committee on Immunization, which makes its recommendations on the basis, of the best available evidence. On this subject, this includes studies from the United Kingdom, Spain, and Germany that found that mixing vaccines is safe and produces a strong immune response. I myself received Pfizer for my first dose and Moderna for my second, and I can assure you that I am very comfortable that I am protected. The most important thing you can do right now is to be fully vaccinated, and especially to get your first dose if you haven't already done this yet. Some of the earliest advice still holds true. The best vaccine is the vaccine you can get, and we're fortunate that there are lots of options now on where to get your vaccine. In Toronto, we continue to make good progress in vaccinations, and we are on the cusp of an important opportunity. The next 2 weeks are critical to youth vaccination and the return to school in September. Vaccines delivered in the next 2 weeks will be done in time to ensure 28 days passes between first and second dose, followed by the 2 important weeks to develop fulsome immunity. Torontonians have embraced vaccination so thoroughly all these weeks and months. I really hope that our young people will embrace this moment too. Elsewhere, there are some areas that need focus by age and location. By age, those 35 to 49 are still inching upward more slowly than I would wish. The first dose coverage for them still sits in the low 70s, and we've got to see that move substantially higher for everyone's benefit. By location, the push is on particularly in regions to the north and west areas of the city, as you heard the mayor say. This area really felt the burden of the pandemic. Many of the people who staff the services we all rely on call it home. For everyone's sake, we need to close that vaccination gap, and we're doing so through a number of means, including increased mobile clinics that take the vaccines where they are most needed. The higher we drive the levels of vaccination, the harder it gets for COVID-19 to mutate and create the next variant. By maximizing our vaccine coverage, we protect our return to the things we've held on for, the things we've sacrificed for. This Friday, we enter stage 3 of reopening. So to be consistent with the province's direction, I'm recommending the Toronto City Council, during its current meeting, repeal 2 of the bylaws put in place as part of the COVID-19 response in Toronto. Specifically, these are the bylaws governing restaurants and other food service settings and the requirement for physical distancing between people in parks and public squares. I'm recommending to Council that for the time being, the current mask bylaw requiring mask wearing in indoor public spaces and the bylaw on certain requirements in shared spaces at apartments and condominiums continue. I'm looking forward to Friday for all of us. Although in the excitement, I want to urge you to not confuse the coming changes and increased choices with a green light to forget the last 18 months. All that's about to happen is a wonderful and long-awaited opportunity for each of us to do more and to live more fully, while remembering what we've learned in the last 18 months and accepting the virus is still here, even as we move in the right direction. With that, I'll now turn it over to Lavin so we can move to the question period.
Thank you, Dr. de Villa and Mayor Tory. We will now begin the media Q&A. As a reminder, it's 1 question, 1 follow-up. And if you do get your name called on, please unmute yourself. And then we do also have staff on the line, including Chief Peg, Marianne Bedard, Carlton Grant, Howie Dayton, and Barbara Gray. So first up, we have Matt Bingley from Global. Go ahead, Matt.
Hi, Doctor. Good afternoon. I'm going to begin on a topic that we've heard a lot about today, vaccine passports. I'm just wondering where both you and Mayor Tory feel that the city needs to be on that topic. And I'm just also wondering, the Solicitor General today suggested that the slip that you get after you receive your second dose should be good enough. I'm wondering if you agree.
So Matt, perhaps I'll let the mayor comment for himself on this issue, but let me start off with this. From a public health perspective, the things that I am most in support of are those measures that actually do something substantively to increase confidence in vaccines and that increase vaccine coverage. So at this point in time, you know, this is still a fairly new endeavor. The notion of vaccine passports is something relatively new in public health practice. So as far as I'm concerned, you know, I won't take anything off the table. Certainly happy to continue conversations. We're always talking with our provincial counterparts on these issues. But first and foremost, the issue is around what measures there are that can actually be demonstrated to increase confidence in vaccines and increase vaccine coverage, because that's really where we all need to be to get us to the other side of this pandemic. I'll let the mayor comment specifically on what his thoughts are.
Well, I associate myself completely with the comments just made by Dr. de Villa, and indeed all of our efforts are really focused on getting more people to get vaccinated, removing barriers, overcoming hesitation, and so on. But my comments that I made earlier today and yesterday are strictly from a practical standpoint. There are people, including the Government of Canada, for returning Canadians who might go away somewhere, including some of our colleges, who have said that they're going to require people to have some proof of vaccination, whether for right or for wrong. Those are their policies, those are their stated requirements. And so I merely made the point, which I stand by absolutely firmly, that some proof of vaccination is going to have to be made available to people. And that can include the receipt that one can obtain, and apparently they've now made clear that you can go back onto the information system through the same website you booked your appointment and get a copy of that receipt. But those are the kinds of pieces of information people have to know. And whether you mix it up with whatever term you call it or whatever, it's just proof that you've been vaccinated. So if somebody asks you, You aren't saying, well, why don't I phone somebody, or why don't I go online on my phone and see if I can find out? People need to have this if they need to have it. And from a strictly practical standpoint, I'm not getting myself mixed into any philosophical or political discussions about this. It's just a very practical matter that if somebody asks, you got to know where you can get the proof. And that's that. One more thing I should say, Matt, with respect to the city's role, because, and this is a good thing, that we were on the provincial system, which registered everybody's vaccinations all together, everybody in the city and everybody around the province. That is the only place where all of that information is registered. And so the city really has no role other than to provide people with the information, as we have done, as to how to go to that particular website and print off what you can get. But otherwise, it really has to be a provincial responsibility, which they've accepted, to say that people can go and get this receipt on that website or on that registration system if they wish to do so.
Follow up? Matt? Mute yourself. Okay, we can come back to Matt. So next up, we have Jeff Gray from the Globe and Mail. Go ahead, Jeff.
Oh, hi, thanks. Hi, Mr. Mayor, I wanted to ask about the homeless encampments issue. You did make some comments this morning at council. There's this path forward letter that many, not just activists, but agencies that work with the homeless have endorsed. And a lot of it seems to echo things the city says it is doing. Is there nothing to be gained from taking a pause and trying to build the trust, go out there again with outreach workers and try and get people to come inside without having to resort to the kind of police presence that we saw at Trinity Bellwoods?
Well, Jeff, we have not stopped in our efforts to work with people experiencing homelessness to convince them on a day-by-day, person-by-person, place-by-place basis to come inside and accept alternate forms of housing other than an encampment. Because we continue to maintain the fact, and I think it's just true, that these encampments are not safe, they're not healthy, and they're illegal. And so we've continued to have outreach workers going out and doing many of the things that are talked about in the letter, and the letter is signed by people I know and people who I respect. But it's signed in some respects almost suggesting that we haven't done any of that or don't continue to do any of that and simply rely on somebody calling the police and saying, you should go in there and deal with this. The only reason the police were ever involved in any of the previous activities were because people who were there to protest the fact that these encampments would in any way be altered were causing a danger to the city workers and the people experiencing homelessness because of unrest that was going on those sites. Otherwise, there would have been need for nothing more than maybe a handful of police officers just to be there to make sure people didn't interfere with the contact that we were trying to make on a continuous basis with people experiencing homelessness. And we've had so much progress. I mean, again, it doesn't make any sense that if we hadn't been doing this kind of collaborative approach all the way along, including 20,000 visits plus to these sites to work collaboratively with people experiencing homelessness, we wouldn't have had the success we've had in moving 1,500 plus people into better kinds of housing. And so, of course, we're going to take a look at the letter, but many of the things we're doing now are things that are mentioned in that letter. We're already doing them. We just don't get any credit for doing it because it doesn't suit the nature of some of the argument that is made by some, not by all. So we'll carry on with that work. But as I've said many times before, I also have a responsibility, the city government also has a responsibility to pay some attention to the representations we get from those citizens who, for example, are being denied the use of their parks. We've had one park where the summer programs for kids in a very needy area have been canceled because of the fact that park is almost entirely taken up with an encampment. And a lot of these structures in that encampment are presently empty, but there are activists who refuse to allow us to remove those empty structures, thus freeing up part of the park for other use. So that can't carry on indefinitely. I'm sorry, and I regret that, but we've continued to do what I've said from the beginning, which is to adopt a compassionate and yet firm approach as to how we have to deal with this. And we're continuing to this day and on this day to be having people going out and visiting and collaborating with people experiencing homelessness to try and get them to a better place.
Okay, thanks for that. I wanted to follow up, I guess, by asking something that's been raised which is some confusion, I guess, about the operation at Trinity Bellwoods or the encampment clearings that might be to come, that it's all being coordinated by the Emergency Operations Center. Is that right? By the COVID Emergency Operations Management team with Chief Pegg. Why isn't it shelter and housing? Why wouldn't they be leading that operation?
The fact is, it's a collaborative approach so that we can be sensitive to all of the different issues. So there has to be representation there, obviously, from the shelter and housing group, which is probably the lead group in the context of making sure there is indoor housing available for people, that there are the supports in place at those indoor housing locations, including hotels. So they're still integrally involved. But what we also did was put other people around the table that would be involved, including the parks, forestry and recreation people. Obviously, the people involved in the enforcement of the law are there really just to make sure that that end of it is covered, and various other city officials, so that all you're hearing is that there's a kind of a table that's been established to deal with the entire issue, and those people have been collaborating with one another right from the beginning in this, because we knew that trying to to have the encampments cleared, which started with getting alternate forms of housing made available to people who were resident in the encampments and other supports that they needed, was obviously a precursor as far as we possibly could to having the encampments no longer continue to be in the parks, which we had previously said, based on the expert advice we got, were unsafe and were unhealthy and were, of course, illegal.
Thanks, Jeff. We're just going to go back to Matt Bingley. Matt, can you hear us?
Yeah, sorry about that. Mute buttons. I'm just wondering, we've been hearing that TFC is ready to begin inviting spectators back as early as even Friday. I'm just wondering if you can confirm that, and if you, just speaking about the phased approach for the city, do you feel like the city is ready for that kind of grand scale of people going back into stands again?
Dr. de Villa may wish to address this as well, because we've all been involved in these discussions, and of course, more so than our involvement has been the overall direction set by the province with respect to the requirements that exist in stage 3 or step 3 of the reopening plan. But TFC made it clear from some time ago that they wanted to be back in business playing at home, and then the question has arisen with respect to what spectators could be in the stands to see those games. And of course, we have outstanding a similar kind of request from the Toronto Blue Jays, who are, I guess, one step behind. They haven't yet been given permission, although we as a city and the province have consented to, from a public health standpoint, to their returning to play in Toronto, subject to certain conditions. And so then the question becomes, well, given the capacity restrictions that mostly apply to smaller venues, what would apply to places like BMO Field or to the Rogers Centre, and how would you work that out? And those are discussions that I think are still ongoing, but more of it is now in the hands of, in the case of TSC, their own decisions about what they're going to do and who they're going to have come to those games. But it is certainly something where we have been very much involved, and as positively inclined to make that happen as is going to be consistent with the safe reopening of the city.
Thanks, Mr. Mayor. Again, a number of the considerations, actually all of the considerations really under step 3 are articulated under the province's legislation and their documentation. And, as far as we're concerned, at this point in time, I think there are many of us, and I made mention of this in my remarks, we're all looking forward to having the opportunity to live life more fully and to enjoy a broader range of activities that are available in our city. But of course, this doesn't preclude people from maintaining good practices. And, I'd like to think that, Torontonians have done a great job over the course of the past 18 months. I think they are extremely well aware of what good practice looks like, when masks are a good extra layer of protection, particularly for those who have unique medical circumstances. So I would just encourage people to continue to follow good public health practice, self-protection measures, and to recognize that outdoor environments are definitely lower risk than indoor environments, and of course, to complete their course of vaccination as soon as is possible. I think taken all together and in keeping with the provincial regulations, we are all looking forward to, again, having a broader range of activities available to us all.
Thanks, Matt. Next up, we have Francine from the Star. Go ahead.
Oh, hi. My question actually is for Dr. de Villa. Dr. de Villa, At the beginning of the summer, you expressed some concern about the rise of more contagious variants, including the Delta. How concerned are you about Delta and other variants now? Could they drive another wave moving into September when kids go back to school?
So Francine, that's an excellent question, and I think it's one that's on the minds of many public health officials, not just here, but the world over. We are seeing resurgences of activities, or COVID-19 activity, I should say, in various parts of the world, particularly amongst those who are unvaccinated. And I think that we all recognize, understanding what we do now about COVID-19 transmission, the more people are moving out, moving around in their community, and particularly as they move indoors, the risk for transmission increases. But so much of the control is truly in our hands because we have available to us safe and effective vaccines. So to the extent that we are able to drive up confidence in vaccines and drive up vaccine coverage across all those who are eligible to receive vaccine, the more we take away the power of COVID-19 to create new resurgences in activity and to create challenges in our environment. So I just can't emphasize enough how important it is for people to continue to get vaccine, to complete that course, so, the first and the second dose, and to do that as soon as is possible.
Do people who, a follow-up question, Dr. de Villa, people who have you mentioned that the variants are sort of moving in that population who are not vaccinated. People who have both vaccinations, are they also at risk of becoming ill from these variants?
So, Francine, there's no 100% guarantee, but I think when you look at the studies and the experiences all around the world, those who are fully protected as a result of vaccine are significantly much less likely to contract disease and therefore much less likely to transmit to others as well. So again, I think all the evidence points towards the safety and the effectiveness of vaccine. Hence, you hear us talking about people really taking advantage of the opportunity. We're so fortunate in this country to have access to these safe and effective vaccines. So I just can't speak enough to how important it is that those who have yet to receive vaccine go out and do that as soon as they can.
Thanks, Francine. Next up, we have Derek from CBC. Go ahead.
Thanks so much. My first question is for Dr. de Villa. In your opinion, should any businesses in Toronto require vaccination in order to enter those facilities when we enter step 3? If so, which ones and why?
Derek, that it sounds like a simple question, and in fact, it's quite complicated. I would suggest this, that certainly it's within the purview of businesses to make assessments as to their own circumstances and understand, what makes the most sense. We know that in indoor environments, particularly where people congregate in large numbers, that risk is obviously higher for a disease like COVID-19. But as I just mentioned in the answer to the earlier question, the one thing we can all do to significantly reduce the risk of transmission of COVID-19, and we have so much of it and opportunities that are available for us, is to get vaccinated. So to my mind, the most important thing that we can do right now, each and every one of us, is if you haven't been vaccinated, please get vaccinated. If you have been vaccinated and you know of people within your network who have yet to receive the protective benefit of vaccine, please help them, speak to them, talk to them about your experience, and help them either book the appointment or get to that appointment. I think the more we are able to do this, the sooner we, move to the other side of this pandemic, and frankly, the safer and the healthier we will all be.
Great. And just to follow up, in Peel Region, the vaccination rates have been strong enough to prompt officials to close their mass vaccination site at the end of this month. Is there a threshold Toronto has in mind that would start a similar process here?
So, Derek, that's an excellent question. We're certainly always looking at that which is happening within our clinics and trying to use our resources as most effective and in the most efficient way possible. So you'll notice you've just heard that, yes, we are continuing to run mass immunization clinics, and there are a number of vaccination opportunities that are provided courtesy of our vaccination partners. We are, as the mayor indicated in his remarks, also actively pursuing more and more focused mobile clinics, particularly in those neighborhoods where we would like to see, a greater increase in terms of vaccination coverage. So as far as we're concerned, there isn't necessarily a specific threshold, but it is a constant assessment as to what our circumstances are and where we can best utilize our resources to increase vaccine coverage and confidence in our vaccine program.
Thank you, Derek. Next up, we have Catherine from Radio Canada. Go ahead.
Merci. My question is for Mayor Tory, if I may, in French. Les discussions sur le nouveau nom, sur le changement de nom pour la rue Dundas ont lieu dans le Conseil en ce moment. Qu'est-ce qui arrive si on approuve ce choix maintenant et qu'est-ce que ça veut dire pour la ville de Toronto?
C'est un moment très historique pour la ville de Toronto parce que nous voulons établir la ville de Toronto, la ville la plus inclusive au monde. Et maintenant, les actions de la part de M. Dundas ont causé beaucoup de traumatisme, et se font encore sentir aujourd'hui. Maintenant, et M. Dundas est un homme qui n'a pas jamais visité la ville de Toronto et c'est une opportunité maintenant de changer le nom et c'est une action très, très importante, très symbolique, c'est une opportunité pour nous de commencer les efforts additionnels pour adresser les concerns, les actes de discrimination et les autres choses pour les populations diverses de la ville de Toronto. Et aussi, dans les mois prochains, nous allons établir un processus minutieux au sujet des changements, les normes et pour régler ces problèmes à l'avenir.
Follow-up?
Merci beaucoup. Have no follow-up.
Merci.
Okay, that's it for today, everybody. Thank you and have a great rest of your week.